guys, it is medical information, and in this session I want to speak about hypertension, a disease found in 10 to 30% of general population. Why hypertension is so important? Hypertension is one of the most common diseases in the general population. As I mentioned, it can occur in 10 to 30% of the people. It can also impose severe cardiovascular, renal, and cerebral sequelae. For example, it can cause heart failure, it can cause cardiac remodeling, it can cause myocardial infarction, stroke, cerebral hemorrhage, and chronic kidney disease. Hypertension is the most common cause of chronic kidney disease, and it can cause a patient needing hemodialysis and kidney transplant. It is also very important to know that the complication of hypertension can be utterly prevented by adequate treatments. Before discussing hypertension, you must know what is the definition of hypertension. Normal blood pressure is usually accepted as lower than a 120 mercury millimeter systolic blood pressure and less than 80 millimeter mercury diastolic blood pressure. Based on European Society of Cardiology, a systolic blood pressure of between 120 and 140 is considered elevated or high normal blood pressure, and a systolic blood pressure of 140 to 160 is stage 1 hypertension or grade 1 hypertension, and systolic blood pressure of 160 to 180 is considered grade 2 hypertension. Also, a systolic blood pressure of more than 180 is considered urgent hypertension. For diastolic blood pressure, a diastolic blood pressure of 80, as I mentioned, is normal, and a diastolic blood pressure of 80 to 90 is elevated or high normal blood pressure, and a diastolic blood pressure of more than 90 to 100 is considered grade 1, and between 100 to 110 is stage 1. The definition differs based on the American Heart Association, and their definition is more strict for hypertension, and they have a lower threshold, but most of physicians are using European Society of Cardiology definition for hypertension, which is easier to use. So how blood pressure can be measured? Actually, there are 3 ways to measure the blood pressure. The first one is the office blood pressure, which the patient goes to a physician office and the physician measures the blood pressure. The tip is that the patient must have too high blood pressure in the office to receive the label of high blood pressure. There are patients who have white coat hypertension. White coat hypertension means that the patient has basically a normal blood pressure, but after going to the office because of anxiety or other reasons, he or she shows a higher blood pressure. And despite the white coat hypertension, some patients have masked hypertension. Masked hypertension means that the patient basically has a high blood pressure, but after going to the office, the office measurement shows that the patient has a normal blood pressure. The other type of blood pressure measurement is in-home blood pressure monitoring. In-home blood pressure monitoring is preferred over office blood pressure because it is more accurate, but someone expert is needed to measure the blood pressure. For patients who have fluctuating or borderline blood pressure, ambulatory blood pressure monitoring is preferred, which is shown in this picture. The patient installs a device that measures the blood pressure every 20 or 30 minutes, and even the patient is in sleep. After that, the average blood pressure will be calculated by the system, and it will be used to decide if the patient is hypertensive or not. There are some tips for blood pressure monitoring. For example, the patient must be at rest, and he must be seated on a chair and relaxed, and it is very important to prevent smoking, drinking, or eating before blood pressure monitoring. Who are at risk of high blood pressure? Basically, everyone is at risk of high blood pressure, but high blood pressure is usually found in subjects who are aged 35 to 55, and if the subject has a family history of hypertension, then it is more common to have hypertension. Also, hypertension is more common in obese or anxious subjects. The first step to treat hypertension is lifestyle modification. Lifestyle modification is the first step in patients who have elevated blood pressure or grade 1 blood pressure, but it can also be used in other patients who have grade 2 or more blood pressure. Weight loss, aerobic exercise, low salt diet, smoking cessation, drinking cessation, and stop using fast foods and using more vegetables and fruits are parts of the lifestyle modification. Lifestyle modification can be used for 2 to 3 months for elevated blood pressure and grade 1 blood pressure, and then in the next visit it can be decided if the patient needs medication or not. But for patients who have grade 2 or more or a persistent hypertension, they need medications. The medications are usually continued for the rest of the patient's life, unless an underlying cause for the hypertension is found. And what is the emergent hypertension? Hypertension can be an emergency if the blood pressure is more than 180 systolic or 120 diastolic mercury millimeter, and there are symptoms of end organ damage. In the absence of end organ damage symptoms, the blood pressure is not assumed emergent hypertension. It is assumed urgent hypertension, which can be managed as outpatient. But in the presence of end organ damage, the patient needs to be hospitalized and admitted in the emergency department, and through workup is needed to detect myocardial damage, kidney injury, visual defects, or any cerebral damage. For example, the emergent hypertension can cause chest pain, chest tightness, or dyspnea and blurred vision, headache, or something like that. So it is very important for hypertensive patients to be familiar with this emergency. If you enjoyed this video, please don't forget like, comment, and subscribe. See you soon.